podium. You have 20 minutes, and we're looking forward to your talk.
Great. Thank you so much. And I'll be presenting a little bit about the role of the advanced practice nurse as it is currently developing internationally. When we look at the role of advanced practice nursing, many countries are developing this role not only as a pathway for the nurse to have it develop professionally, but also to help meet the needs of patients and families as well. So we see it developing in many different areas, in different countries depending on their healthcare needs. There's also expectations from patients and families to have care that results in good outcomes. They want to be educated about their disease process. They want to know how to manage their condition at home. They want to know their medications, and the advanced practice nurse is in a role to be able to educate as well as explain and take the extra time to be able to reinforce those concepts. There's also concerns about costs, the cost of healthcare. So by doing interventions through research or quality improvement to decrease the cost of care or to help the team decrease stays in the hospitalization will result in cost savings as well. The International Council for Nursing has designated that the advanced practice nurse is educated and trained at the master's level. So they have coursework in pharmacology and pathophysiology and physiology and clinical decision making. They have coursework in terms of disease management, as well as different concepts in terms of ethical practice and communication and counseling. If you look in the U.S., we use Wikipedia a lot. So if something exists, Wikipedia has something on it. And they actually have a page, which I was surprised, on advanced practice nursing. And they identify advanced practice nursing as a level of nursing practice that utilizes extended and expanded skills, experience, and knowledge in assessment, planning, implementation, diagnosis, and evaluation of the care required, and that nurses who practice at this level are educationally prepared at the postgraduate level. Although many countries have the master's degree, in the U.S., actually several years ago, they started a doctoral level preparation for advanced practice nurses, so that option is also available in the States. In the U.S., we have had traditionally 4 roles for advanced practice: the certified registered nurse anesthetist, who assists anesthesiologists in the theater to provide anesthetics; the certified nurse midwife, who provides well women gynecologic care; the clinical nurse specialist, who is really a clinical educator, also participates in research; and then the nurse practitioner, which is an advanced practice nurse who is actively involved in clinical practice in hospitals or clinics or in collaborative practice with physicians. In the U.S., we currently have over 200,000 advanced practice nurses. Now, while this seems like a lot, we actually have 50 states, so we still have states where we do not have sufficient numbers. But this shows you the designation between nurse practitioner out of those 4 different roles: the nurse practitioner, the clinical nurse specialist, the nurse midwife, and the registered nurse anesthetist. Nurse practitioners make up the largest percent. In terms of practice settings, predominantly the role started out in primary care, so nurses were working in clinics or in practice with physicians in offices. In outpatient settings, we've moved now to hospital settings, and that's the role of the acute care nurse practitioner, but they also practiced in long-term care, in outpatient settings, public health, and also emergency rooms as some specialty areas. But again, we're focusing in our role in the ICU on the inpatient management of patients. In terms of specialty area, the role actually started in pediatrics, but family nurse practitioners represent the largest percent of nurse practitioners, and they work predominantly in primary care. In the U.S., we have a lot of rural areas where there are not healthcare providers, and so the nurse practitioners help to meet some of the healthcare needs in clinic settings. So that's why family nurse practitioners make up the largest. And acute care, which was developed for ICU and inpatient management, is one of the growing, but again, not as many as we have family. In terms of practice settings of acute care nurse practitioners, our American Academy of Nurse Practitioners conducts a sample survey every several years, and the latest one shows again that most of the acute care nurse practitioners work in hospital settings. as compared to practice offices or clinic settings. In terms of the role, we have regulations in each state that designates the scope of practice of nurse practitioners and advanced practice nurses. And many states do require a written collaborative practice agreement. Some states now no longer have the requirement for written, but there is some collaboration with the physician. And they get their master's degree, their specialty training in their program, prescriptive authority, and also they are eligible to become credentialed and privileged to do procedures. This is a map of the U.S. showing how the different states vary in terms of their regulation of advanced practice nurses. Those states in green have a written collaborative practice agreement, whereas those in blue have a requirement for physician involvement but not a written collaborative practice. And those in yellow have no requirement for a written collaborative practice, and you can see some of these are what we term our rural states, or they're states that have populations and not many healthcare facilities in comparison to the population. So in those states, there's more independent practice of those practitioners. In terms of prescribing privileges, this shows differences as well. The states that are in yellow, which is majority of the states, there's a written collaborative agreement for prescribing privileges. And in the other states, there's no formal written agreement required, but oftentimes they do have an unwritten collaborative agreement for prescribing privileges. In terms of components of the advanced practice nurse, particularly the nurse practitioner, they're very much involved in active patient care management. So they're conducting physical exams, they're writing orders, they're rounding with the physicians, they're, again, facilitating consultations, they're focusing in on discharge planning, so really a collaborative type of role, and to help to facilitate patient care as well. In terms of activities and procedures, we had the opportunity to conduct a 5-year study with over 400 acute care nurse practitioners, and we looked at how their role developed and evolved. And we surveyed them to look at what is the most frequent interventions or activities they were engaged in. And as shown here, the number one area that they felt they were making the most impact was discussing care with family. So again, providing education, providing for continuity of care. They were also actively involved in patient care in terms of ordering and interpreting lab tests and working with physicians to get interventions based on lab tests, ordering and interpreting x-rays, and working with physicians to manage patient care, helping to initiate consultations that patients needed, and then again planning for discharge. So those were some of the key areas that they were working in terms of activities. The International Council for Nursing periodically conducts surveys of other countries as to how they are developing the advanced practice role. In their last survey, they looked at 18 countries that had identified that they had some development of the advanced practice nurse role. And out of these 18 countries, 75% stated that they currently had formal recognition, so a current role existed in their country that oftentimes was designated by the Minister of Health or their health division. 58% had formal training programs at the master's degree. However, 14 different titles were identified for the advanced practice nurse role, and so this is one thing that the International Council of Nursing is advocating for, is that we have similar titles so there's clarity in what these advanced roles are doing. These next several slides just show you the countries that do have advanced practice nursing roles developed, and it's alphabetical in listing. So these were the countries that currently have or were developing advanced practice roles for nurses in terms of international focus. And these were the different types of roles that these countries identified, many having nurse practitioners versus clinical nurse specialists. And so the APN is a designation for advanced practice nurse. The NP means nurse practitioner. So a variety of different roles in different countries. This shows a continuation of different countries. Again, predominantly nurse practitioners were the most focus areas that countries were looking to develop, as well as clinical nurse specialists. and as well as other areas. Now you can see the U.S., we have the most, what we call alphabet soup, the most acronyms, but that's because we have the most types of different practice arenas. But internationally, the nurse practitioner is probably the one that most countries have most often developed. In terms of focus areas, these next several slides show you the countries that developed their role for primary care settings, meaning outpatient, clinic-type settings, is where their need was to develop the advanced practice nurse role. And these were countries that originally developed their role based on training and need for hospital-based practice. In terms of the hospital setting itself, as I had explained during my talk earlier, the role is really a comprehensive care to work collaboratively with the physician team, a heavy emphasis on education and counseling and consultation, also focused in on such things as palliative care or advanced directives, staff nurse education, and research or quality improvement projects. One hospital website actually calls out the advantage of having advanced practice nursing as part of the team. This comes from Cedars-Sinai Medical Center, and they actually identify that advanced practice nurses are a vital part of the care that's given to their patients. So many more hospitals are promoting that they have advanced practice nurses. There's more public awareness of this role in hospitals, and patients are becoming satisfied by having this practitioner being able to seek consultation and education from them. Some essential considerations when developing the role, because it is oftentimes met with resistance and barriers just due to the uncertainty about what these practitioners do in their roles. One thing that's very important is the scope of practice. For an acute care nurse practitioner, they're educated and trained to take care of patients who are acute and critically ill in ICUs and other settings. I told you that in the U.S. we have predominant amount of family nurse practitioners who were primary care educated, so they would not have the scope of practice to work in an intensive care unit in the hospital. So the educational level really depends what the role will be in the clinical practice setting site. And the scope of practice is also dependent on their education. We have educational programs strictly for acute and critical care nurse practitioners. There's educational programs for family nurse practitioners, pediatric nurse practitioners. So how they're educated designates how they will practice. The other focus is what current exists in the countries for regulation and legislative framework. In the United States, each of our 50 states has practice acts that regulate the roles of the advanced practice nurses. So that's another area of consideration as well. In terms of other essential considerations, what are current healthcare needs or roles that could be developed within the country to meet a current need? In my visits here previously to your country, as well as my visit this time, I actually came in earlier, and on Thursday I met with the Hellenic Regulatory Board of Nursing and met with some of their officers and had some discussion about their advances and really trying to promote the development of this role and some of the barriers that they're currently facing. And they mentioned the idea that you currently have a surplus of physicians. So we dialogued a bit about what could be some roles that advanced practice nurses could play. What roles could they meet in terms of really not only patient and family education, but one of the roles we've had in the States as well as in Australia and UK is really the role of the advanced practice nurse in serving on the medical emergency team, or what we call rapid response team, which is an outreach that a ward nurse can call the advanced practice nurse to assess their patient if they think something might be wrong, but they don't really have any vital sign changes to report to the physician. It's 2 o'clock in the morning. They don't want to wake up the surgeon unless they really know there's something going on with this patient. And so that has been a role that advanced practice nurses have played, is being a consultant that the ward nurses can call to really reassess and say, yes, we need to call the physician. There's a change in this patient. So that's just one example. And other considerations include what will their function be. Education, it's highly advocated that it be a master's preparation. What are the number that are required for a country to develop? How many practitioners will they need to start the role and to advance the role? And what will be the career pathway? As I shared with you in the U.S., we started out in a pediatric focus and then moved more towards primary care. But as we started to have shortages of intensivists, or critical care trained physicians, the role for the nurse practitioner in the ICU then was formed. So that's really how the roles develop. Other challenges, and I mentioned this before, is resistance, so gaining acceptance of the role. So it really takes administrative support, it takes physician support, it takes nursing support to really develop the role in terms of making sure that there is a designated scope of practice, that there is support for this role. Some countries, as we do in the U.S., give financial incentives for nurses to pursue this training and have a different scope of practice. So all these aspects are essential for consideration. Having a career pathway, we actually have had very much success in having some of our senior nurses pursue this as a career option instead of leaving nurses. If they're nursing altogether, it's a way for them to advance into their career. It's also attracted other healthcare individuals to pursue advanced practice nursing as an option as well. So in terms of why no advanced practice nurses in Greece yet, I think it's definitely time to talk about establishing the role. I think one of the advantages that you have here in your country is that you already have a master's degree education for your nurses within your universities. So that already exists. So it really would just entail having the legislation to develop this role. Many countries struggle to develop the role because they don't even have a master's educational program in their country. So their first step is trying to have to develop that master's education. You have the advantage of already having that develop within your university, so that definitely is advantageous for you. Other areas that will need to be considered are possible roles for the advanced practice nurse, a clinical educator, a consultant within the ICU, someone who can not only mentor new staff but make sure that protocols and pathways are followed, maybe nurse practitioners to work with physicians in specialty areas. If you have physicians who have growing numbers of patients and they need help managing those patients, we have nurse practitioners in acute care who work with some of our specialty groups. I mentioned neurology this morning, but certainly other areas such as orthopedics and vascular surgery and emergency department care. We have definite areas of specialization that we have developed in the role based on needs not only of patients but also on physician practices as well. And then again, providing education and training for the advanced practice nurse. One distinct advantage is that you currently have the master's education as well. So I have had dialogue while I've been here, not only with some of the nurses, but also with some of the university professors, and I hope to have ongoing dialogue because I think it would be advantageous for you to have this as an option for your nurses to advance really their training and education, but also to be able to meet the growing needs of your patients and families, and to support the development of the role. Some possible areas for consideration is, as I've shared with you, in the U.S. we have ICU or service-based. We have advanced practice nurses who serve as a family liaison nurse, staff nurse in education. Transitional care is an area that we've been targeting, meaning when the patient is transferred out of the ICU to have an advanced practice nurse continue to monitor their care. In Australia, they actually have an ICU nurse liaison that bridges the care and follows the patient out to the step-down unit or the wards to make sure that there's continuity of care, and that starts the discharge planning process as well. So such things as outreach, discharge planning, quality improvement. Many of our advanced practice nurses have led initiatives that have decreased our urinary tract infection rates, have decreased our central line infection rates, have helped to streamline our processes for monitoring ventilator-associated pneumonia, and have really made an impact on quality of care for our patients in the ICU. And then research. We have nurse practitioners doing independent research in our units in terms of the impact of different interventions to prevent skin breakdown on patients or to enhance nutritional support of patients to really help facilitate patient care directly. So with that, I thank you. I've enjoyed my opportunity to come again, and I hope we will have sustained communications to make this a reality for you in Greece in the near future. So thank you so much.
Thank you so much for this great presentation. As I was telling the audience before, we keep inviting you and inviting you. Hopefully something will change. Unfortunately, it hasn't changed so far, and this is the purpose of your talk. Now, I have some questions, but I would like the audience to, especially the nursing audience, to ask some questions. Katerina, maybe?